Okay.
We're at the annual meeting of the North American Menopause Society, and I have just heard a really interesting lecture on the BRCA, or breast cancer gene, and it was given by...
I'm Dr. Susan Domtek of the University of Pennsylvania.
And just for purposes of discussion, if you have this BRCA gene, what's the problem?
Right, so BRCA1 and BRCA2 are two genes that everyone's born with, but if you're born with one bad copy of either of those genes, you have a significantly increased chance of developing breast or ovarian cancer. And the lifetime risk of ovarian cancer is up to 40%, the lifetime risk of breast cancer is up to 70%, so these are very significant risks.
So instead of like 1.7% or some low amount for ovarian cancer, it's up to 40%.
Correct.
And for breast cancer, it's probably about lifetime risk
from 13% to as high as 70%. So these are very significant.
If you have the gene.
If you have a gene mutation, yep.
So it's very interesting, this problem of the gene, because who would be tested for this? Who would you want to test?
Right. So the people who are at the highest risk of having a inherited mutation in one of these genes are people who've had early onset breast cancer, particularly those who are diagnosed under 40, those who have triple negative breast cancer, male breast cancer, any woman with ovarian cancer, people who have a strong family history of breast and ovarian cancer, and importantly, individuals who are of Jewish descent, who have breast, ovarian cancer, or pancreatic cancer. And there's even some discussion about whether or not we should be testing every woman who's of Jewish descent.
Now, why does it matter if you have this gene? I know that it increases your risk of cancer, but you've got the cancer, or you don't have the cancer, so why does it matter?
Well, if we know that you have a gene mutation, there are things that we can do to detect a cancer early, so it's at a better stage. And for instance, we can increase people's breast cancer screening using breast MRI. And more importantly, we can do things to prevent cancer. So the most effective strategy we have is the prophylactic removal of the ovaries. And removal of the ovaries decreases the risk of ovarian cancer. It decreases the risk of breast cancer. And most importantly, it actually leads to women living longer because they've removed their ovaries.
Now, when you say ovaries, you also usually will take the fallopian tubes out as well, right?
Yes, that's right. It's well corrected by a gynecologist. So yes, when we say ovaries, we're really talking about salpingo-oophorectomy, or removal of both the fallopian tubes and the ovaries.
So here we have a chance by surgery to protect, and of course BRCA1 is a little bit higher risk than BRCA2 for
ovarian cancer. Yes.
And so these are, of course, big decisions and beyond what we can talk about in this video, but one of the things that is really interesting that you talked about is the fact that there's so many women that are worried about taking estrogen and getting breast cancer.
Right.
And so many times women who have their ovaries and tubes taken out to protect themselves from getting breast cancer or ovarian cancer and it's funny to think you could take the ovaries out and help reduce the risk of breast cancer, but that's in fact correct. So, and yet, here's a young woman who's in menopause because you've removed her ovaries and her tubes.
Right.
What's the story on estrogen in those women?
Right. Well, the one thing that I always go back to is that breast cancer, we have good screening. Most women who are diagnosed with breast cancer are diagnosed at an early stage, and most women survive their breast cancer. But ovarian cancer is very different. We don't have good screening. The women who are diagnosed with ovarian cancer are often diagnosed at a late stage, and most women with late stage ovarian cancer don't do well. Ovarian cancer is a real problem. And we're taking out these ovaries mainly so people don't develop ovarian cancer, because it's a very terrible cancer. And so when people are worried about the estrogen, I remind them that they're making estrogen now. And what we're doing is just giving some back to them to mitigate the menopausal symptoms that they've had. And we and others also have data that after you prophylactically remove the ovaries, giving hormone replacement therapy back actually doesn't. It first of all decreases breast cancer risk, and it doesn't seem to really increase it again when you take that hormone replacement therapy back. So it's important that women know that this is an option for them and that they need to talk to their doctor about it.
So that's very important, that a woman who has her ovaries taken out doesn't have to feel that she's going to face an early menopause and all of the potentially negative things that come with it, but has the opportunity to protect her ovarian or breast cancer risk by having the surgery, and yet be able to not add to that risk by replacing estrogen.
Exactly right, and it's important because there are a lot of women who are hesitant to have this very important surgery done because of very understandable concerns about how they're going to feel. And we have this opportunity to give them estrogen back and to really help mitigate those negative symptoms.
Anything else you'd like to add?
No, except that family history matters, so talk to your doctor about your family history of cancer and see if genetic testing is right for you.
Thank you very much.
Thank you.